Coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome, and Middle East respiratory syndrome. In 2019, a new coronavirus was identified as the cause of a disease outbreak that originated in China. The virus is known as severe acute respiratory syndrome coronavirus 2. The disease causes is called coronavirus 2019 or shortened as COVID-19. In March 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. Public health groups, including the U.S. Centers for Disease Control and Prevention and WHO, are monitoring the COVID-19 pandemic and posting updates on their websites. These groups have also issued recommendations for preventing and treating the virus that causes COVID-19. Signs and symptoms of coronavirus disease 2019 may appear 2 to 14 days after exposure. This time after exposure and before having symptoms is called the incubation period. You can still spread COVID-19 before you have symptoms. Common signs and symptoms can include fever, cough, and tiredness. Early symptoms of COVID-19 may include a loss of taste or smell. Other symptoms can include shortness of breath or difficulty breathing, muscle ache, chills, sore throat, runny nose, headache, chest pain, pink eye or conjunctivitis, nausea, vomiting, diarrhea, and rash. This list isn't complete. Children may have similar symptoms to adults and generally have mild illnesses. The severity of COVID-19 symptoms can range from very mild to severe. Some people may only have a few symptoms, some people may have no symptoms at all, but can still spread it, which is called asymptomatic transmission. Some people may experience worsened symptoms, such as worsened states of breath, pneumonia, about after a week symptoms start. Some people experience COVID-19 symptoms for more than 4 weeks after their diagnosis. These health issues are sometimes called post-COVID-19 conditions. Some children experience multi-system inflammatory syndrome, a syndrome that can affect some organs and tissues several weeks after having COVID-19. Rarely, some adults experience the syndrome too. People who are older have a higher risk of serious illnesses from COVID-19, and that risk increases with age. People who have existing medical conditions also may have a higher risk of serious illnesses. Certain medical conditions that may increase the risk of serious illness from COVID-19 include serious heart diseases such as heart failure, coronary artery disease, or cardiomyopathy, cancer, chronic obstructive pulmonary disease or COPD, type 1 or type 2 diabetes, overweight obesity or severe obesity, high blood pressure, smoking, chronic kidney disease, sickle cell disease or thalassemia, weakened immune system from a solid organ transplant or bone marrow transplant, pregnancy, asthma, chronic lung disease such as cystic fibrosis or pulmonary hypertension, liver disease, dementia, Down syndrome, weakened immune system from bone marrow transplant, HIV or medications, brain and nervous system conditions such as strokes, substance use disorder. This list is not complete. Other medical conditions may increase your risk of serious illness from COVID-19. If you have COVID-19 signs or symptoms, or you've been in contact with someone diagnosed with COVID-19, contact your healthcare provider right away for medical advice. Your healthcare provider will likely recommend that you get tested for COVID-19. If you have emergency COVID-19 symptoms such as trouble breathing, seek care immediately. If you need to go to a hospital, call ahead so that the healthcare providers can take steps to ensure that others aren't exposed. If you have emergency COVID-19 signs and symptoms, seek care immediately. Emergency signs and symptoms could include trouble breathing, persistent chest pain or pressure, inability to stay awake, new confusion, pale, gray, or blue-colored skin, lips or nail beds, depending on skin tone. This list isn't complete. Let your healthcare provider know if you're an older adult or you have a chronic medical condition such as heart disease or lung disease, as you may have a greater risk of becoming seriously ill with COVID-19. Infection with severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 causes coronavirus disease 2019 or COVID-19. The virus that causes COVID-19 spreads easily among people. Data has shown that the COVID-19 virus spreads mainly from person to person among those in close contact, within about 60 feet or 2 meters. The virus spreads by respiratory droplets released when someone with the virus coughs, sneezes, breathes, sings, or talks. These droplets can be inhaled or land in the mouth, nose, or eyes of a person nearby. Sometimes the COVID-19 virus can spread when a person is exposed to a very small droplet or aerosols that stay in the air for several minutes or hours, called airborne transmission. The virus can also spread if you touch a surface with the virus on it and then touch your mouth, nose, or eyes, but the risk is low. The COVID-19 virus can spread from someone who is infected but has no symptoms. This is called asymptomatic transmission. The COVID-19 virus can also spread from someone who is infected but hasn't developed the symptoms yet. This is called presymptomatic transmission. It's possible to get COVID-19 twice or more, but this is uncommon. When a virus has one or more new mutations, it's called a variant of the original virus. Currently, the CDC has defined two variants of the virus that causes COVID-19 as variants of concern. These include the Delta variant and the Omicron variant. The Delta variant is more contagious than earlier variants and might cause more severe diseases. The Omicron variant spreads more easily than other variants including Delta, but Omicron appears to cause less severe disease. Risk factors for COVID-19 appear to include close contact with someone who has COVID-19 and being coughed or sneezed on by an infected person. Although most people with COVID-19 have mild to moderate symptoms, the disease can cause severe medical complications and lead to death in some people. Older adults or people with existing medical conditions are at greater risk of becoming seriously ill with COVID-19. Complications can include pneumonia and trouble breathing, organ failure in several organs, heart problems, a severe lung condition that causes a low amount of oxygen to go through your bloodstreams to your organs, blood clots, acute kidney injury, additional viral and bacterial infections. The U.S. Food and Drug Administration has given emergency use authorization to some COVID-19 vaccines in the United States. The FDA has approved the Pfizer BioNTech COVID-19 vaccine, now called Comirnaty, to prevent COVID-19 in people ages 16 and older. The FDA has given emergency use authorization to Pfizer BioNTech COVID-19 vaccine for ages 5 through 15. The FDA has approved the Moderna vaccine, now called Spikevax, to prevent COVID-19 in people aged 18 and older. A vaccine can prevent you from getting the COVID-19 virus or prevent you from becoming seriously ill if you get the COVID-19 virus. In addition, COVID-19 vaccination might offer better protection than getting sick with COVID-19. A recent study showed that unvaccinated people who already had COVID-19 are more than twice as likely as fully vaccinated people to get infected with COVID-19. After getting vaccinated, you can more safely return to many activities you may have not been able to do because of the pandemic. However, if you're in an area with high number of people with COVID-19 in the hospital and new COVID-19 cases, the CDC recommends wearing a mask indoors and in public. You're considered fully vaccinated 2 weeks after you get a second dose of an mRNA COVID-19 vaccine or 2 weeks after you get a single dose of the Johnson & Johnson COVID-19 vaccine. You are considered up to date with your vaccines if you've gotten all the recommended COVID-19 vaccines, including booster doses when you become eligible.